And now we are going to turn to the next agenda item. You can see on the screen the relevant documents. And before we switch to the next agenda item, let me invite our respected colleagues to the Presidium. So the Director of the Country Health Policies and Systems, Dr. Natasha Zapardi Muscat, and the Health and Workforce Regional Advisor, Dr. Thomas Zapata, and the WHO representative in Tajikistan, Dr. Viktor Aslavsky. Yeah, please join us and take your seats. And now I would like to invite you to watch a short introductory video to set the scene for the agenda item ahead of us. Please. Thank you for this, and this is really touching, and we really need to take care of for those who is taking care of us, and we really need to invest a lot to the health workforce. So let me remind you that following on from the launch of the WHO Europe report, Health and Care Workforce in Europe, Time to Act at Regional Committee 72 in Tel Aviv, Israel. Today, the Regional Committee is being invited to consider a new action framework on the health and care workforce, setting out the course of the next 5 years. In addition, the Regional Committee is invited to adopt a related draft decision, which was developed through a member states-led process. So now I would like to invite Dr. Natasha Zapardi Muscat, Director of the Country Health Policies and Systems, to present on this critical challenge for health systems in all our countries. and the importance in that context of a new European framework for action on health and care workforce for the WHO European region. So, Dr. Azapardi Muscat, you have the floor.
Thank you very much, Dr. Sharanov. Good morning, and it's my pleasure to be here to introduce a framework for action on the health and care workforce. Never has the European region had such a high density of health workers. So why are shortages of health workers worsening? Well, health workers are aging, and this was made abundantly clear in the report we launched at the last regional committee. Health workers are resigning. Health workers are migrating out of countries, and in some cases also out of our region. And let us not forget health worker deaths during COVID. Besides the finite number of deaths, the deaths have also had an impact on other members of the workforce and on prospective entrants. So that is on the one hand, on the supply side. On the demand side, you know very well that in the European region, we have a fast-aging population. With this is the associated burden of chronic diseases, an increase in legitimate patient expectations, and still many health systems struggling with backlogs that accumulated during COVID. So we do have what we have called last year also a ticking time bomb. We also know that in some parts of our region, the health workforce density has actually decreased. And again, in some countries, the proportion of health workers over the age of 55 is very high, particularly in some parts of the workforce, such as in primary healthcare. So last year, with you, we embarked on a journey. And one of the important milestones was the high-level meeting on the health and care workforce, which many member states and non-state actors supported and attended in large numbers, where we were very pleased to launch the Bucharest Declaration on the health and care workforce, a clear call to action. So today, as you know, we have come to a point where we are able to present the framework for action. This builds on the 2017 framework, is a foundation to fix what is the health workforce crisis in our region, and provides also a blueprint to implement priority healthcare actions at country level. Because whilst today, seated in this room, we will be making an important statement, what is truly important is to get the results of this on the ground in countries, making a difference in the lives of each and every health and care worker across our region. You have all seen this diagram with the 5 petals. This is our framework for action. At the center, we have placed the image of the worker, typified by a woman, because the large proportion of health and care workers in our region are in fact women. And we need to start by focusing on the health workers themselves. If we want to retain and recruit, we need to start by working on working conditions, on mental health and well-being. Moving outwards to the left, we have to be able to build a supply pipeline. And there we need to focus on educating and training the right numbers and composition in line with our needs. But we also need to optimize the performance. We need to make sure that our scarce health and care workers are doing what they have been trained to do and what they are able to do, and that they are provided and equipped with the right conditions, technologies, tools, digital solutions to do this. And then moving further to the left and to the right of our framework, on the one hand, our 4th pillar we call plan. We need the data, we need the overview, we need the governance, and we need to work also with other sectors. This is not something that the health sector can do alone. And finally, we need to invest. We need more investment, but we need smarter and better investment too. And our framework for action is built in such a way that there are actions for member states to take and complementary actions that we undertake to take as WHO Secretariat to support you in implementing those actions. I would also like to thank all the member states, but particularly Romania, Professor Alexandru Rafila, and also Secretary of State Pistol and Dr. Theodor Bildaru, who have worked really hard to coordinate the resolution on the health and care workforce. And we are delighted to see today this high-level political commitment and the resolution being co-sponsored by 37 countries across the European region. I believe that this sends a very strong and encouraging message to health and care workers across the region. We will, of course, be picking up on this important theme of empowering and placing as agents of change and health system transformation the healthcare workers working hand in hand with people and using the right tools and solutions when we come to our Tallinn conference. Allow me finally to thank our team headed by Dr. Thomas Zapata, and allow me to thank people who are familiar names to you because they have been working with you in countries. Maggie, our nursing and midwifery officer, Chris, our health workforce officer, Jana, who has been a new addition to the team and has worked very much with you all on incorporating the work into this framework, and the recent addition, Sulakshana, which almost allowed us to double our technical officer capacity, which was made possible through the UHC partnership, a partnership which several member states in the room are supporting directly and indirectly. Thank you very much.
Thank you very much, Dr. Zapardi-Muscat, for this information. And now I would like to give the floor to Dr. Viktor Aslavsky, WHO country representative to Tajikistan, who will speak about the implementation of the framework for action from a country perspective. So, Dr. Aslavsky, over to you.
Thank you, Mr. Chair. Your Excellencies, distinguished delegates, dear participants, and dear colleagues. I have the honor and privilege to serve in WHO country office in Tajikistan, and one of the areas of our cooperation is strengthening the healthcare workforce. And this is outlined also in the national strategies, called Strategy on Healthcare of Population of the Republic of Tajikistan up to 2030. Tajikistan, like many other countries of the region, is facing the same type of challenges. Aware of the situation, the Tajik government has in recent years taken important measures to increase the number of medical graduates. Currently, the medical graduates coverage is higher than the average in the Central Asian region. So there was a steady growth of more than 77% only in the past 10 years. But when we look to the density, we can see also a growth of 22% for nurses in the last 7 years and 11% for midwives. Doctors' density increased as well, but only with 2%, knowing that here the factor time plays a determinant role. Health labor market analysis is one of the important tools that we used with the Ministry of Health to describe, evaluate, and assess the situation. Geographical distribution and density emerged as one of the important challenges. For instance, we observed significant need of family doctors outside Dushanbe, the capital city, and also in other cities, in the context where 70% of the total population is living in rural areas. Primary health care has been broadened the reach and the coverage improved in 10 years from 82% to 97%, and this is a factor that explains the need of family doctors. Health financing remains also a systemic challenge in funding mechanisms for doctors, nurses, and midwives, and it is regarded as a serious challenge that requires retention strategies with innovative approaches. What have we done? We organized the coordination between development partners and the government. We organized policy dialogues to present the health labor market analysis where strategies direction were established. We supported study visits to WHO demonstration platform in Kazakhstan, to Turkey, to Poland, in partnership with the World Bank, the EU delegation, and the GAZ, the German Society for International Cooperation. But all these measures have to be inserted within the whole ongoing healthcare reform, an important project supported by the EU delegation. Next steps. Ministry of Health is working on the National Human Resource Development Plan, where we are privileged to support and help. It will contain a couple of initiatives aiming to strengthen this area, like financial and non-financial incentives, adjusted planning and redistribution, task optimization, strengthening the role of nurses, continue to increase the number of graduates and improve the quality of educational system. As a WHO, we are providing leadership and we convene partners to support this development plan and to align that with its current and future efforts to strengthen the healthcare workforce. We know that this does not have a rapid fix. We know that it will take time and effort and a lot of commitments on behalf of the stakeholders because it's a complex endeavor and because beyond the numbers and beyond the strategies and plans, we deal with, finally, with people's dreams, with their feelings, with professional careers and their destinies. Thank you, Chair, for the attention, and thank you all.
Thank you very much, Dr. Alsavsky. It is really important to take into account the country perspective when implementing the framework for action. And now I would like to open the floor for any comments and remarks. And I would like to remind you about the time limits, and we will force you to stop if you over the limits. So please, Spain, you have the floor.
Thank you. Honorable Chair, distinguished delegates, Spain delivers this statement on behalf of the EU and its member states. The European Union and its member states commend the collective dedication and efforts of health and care workers in building and sustaining resilient health systems throughout the region, particularly during challenging times such as pandemics and other emergency situations. We underscore the critical role of the health workforce in advancing universal health coverage and addressing evolving health needs as recognized in the recently approved political declaration of the high-level meeting on universal health coverage. Acknowledging the principles outlined in the resolution and the framework for action on the health and care workforce in the WHO European region for 2023-2030, the European Union emphasizes the following key actions and commitments. We stress the necessity of substantial and sustained investments in health workforce education, training, and professional development. It is essential to enhance skills, competencies, and adaptability, ensuring the delivery of high-quality care and fostering innovation in health service delivery, supported by digital solutions. In this regard, we commend the creation of the WHO Health Academy and the comprehensive work done by the Academy's leadership until now. We fully support the measures to improve the retention and recruitment of health and care workers. This includes addressing working conditions, care progression, and support systems. Special attention must be given to underserved areas and initiatives that promote ethical migration practices. We are committed to creating safe and supportive work environments for health and care workers, optimizing their performance and capabilities. This encompasses addressing occupational health and safety, gender balance, and preventing violence, including sexual harassment and abuse, promoting mental well-being, and utilizing workers' capabilities to the fullest. We emphasize the importance of strategic workforce planning, considering evolving health needs, such as demographic changes and dynamics within the health labor market. It is essential to engage stakeholders and employ research and data to inform policies and ensure a balanced distribution of healthcare workers. Therefore, we strongly support the adoption of the resolution and the framework for action on the health and care workforce in the WHO European region for 2023-2030. And we commend the collaborative efforts of the Member States involved in formulating and negotiating the resolution. Furthermore, we acknowledge and affirm our commitment to the principles set forth in the Bucharest Declaration on the health and care workforce. The European Union and its member states stand ready to collaborate closely with the WHO European region and its member states in order to realize these commitments. By fostering a strong health and care workforce and building on the framework for action, we believe we can achieve a more resilient health system and work towards a goal of health for all. In the name of EU member states and personally as part of this workforce, I want to thank you.
Thank you, Spain. Now I would like to give the floor to Malta. You have the floor.
Thank you, Chair. Regional Director, distinguished delegates. We, the Member States participating in the WHO Small Countries Initiative, Andorra, Cyprus, Estonia, Iceland, Latvia, Luxembourg, Malta, Monaco, Montenegro, San Marino and Slovenia, align with the statement delivered by Spain on behalf of the EU and its Member States. A resilient and fit-for-purpose health workforce is central to the health system's ability to deliver person-centered health services that meet growing needs and expectations. All countries face similar challenges, such as uneven distribution, suboptimal skill mix, and shortages of health and care workers. Furthermore, countries are faced with increasing difficulties in retaining professionals in the health sector due to stress and burnout. There is also a need to attract young people into the health and care professions, given the workforce itself is rapidly aging. Moreover, our health systems and health workforce must be equipped to manage impacts of other global challenges, such as climate change. The recent intense and prolonged summer heat waves and floodings and their impact on our health systems have clearly highlighted this additional challenge. Collaboration to strengthen capacity for the development and implementation of effective human resources strategies and policies is one of the main priorities for the Small Countries Initiative. The Working Group on Human Resources for Health is the convening mechanism for cross-country collaboration and exchange among the 11 countries with populations of 2 million and less. For many small countries, ensuring self-sufficiency and maintaining specialist skills of their health workforce is a particular challenge, underpinning the importance of cross-border collaboration in education, continuous professional development, and cross-border mobility of health workers. Workforce planning is heavily dependent on an understanding of supply and demand factors, identification of bottlenecks, and assessment of resource implications in different scenarios. Improving the availability and collection of accurate data and evidence for planning purposes is an area where further work and effective tools are needed to support and inform long-term planning of workforce needs. Furthermore, a strategic approach to planning requires cross-sectorial approaches and engaging other governmental sectors. The Human Resources for Health Leadership and Management Executive Course, organized by WHO Regional Office, is a great opportunity for capacity building and contributing to the necessary skills, tools, and evidence base required by the health sector for more effective strategic leadership. Given our small populations, we are even more so compelled to be innovative when it comes to the optimal use of limited resources, as well as to be able to attract young people to the health sector. Wise use of digital tools is an important factor to optimize performance and improve working conditions, including reasonable workload.
I will ask the Malta to finish
Yes.
your statement as you are reached the time
I will
limit.
submit the written statement. So the health ministers, the framework is a very helpful framework in guiding the national strategies, providing practical tools and evidence, and we fully support the adoption of the resolution, We thank the WHO Regional Office and the European Office for Investment for Health and Development in Venice for their unwavering support. Thank you.
Thank you. Thank you, Malta. Now I would like to give the floor to Romania. Please, you have the floor.
Thank you, Chair, Regional Director, distinguished delegates, dear colleagues. Of course, we align with the statement delivered by Spain on behalf of the European Union and its members. Taking care of those taking care of us. It was a powerful message. Today we gather in this esteemed assembly to address a critical and fundamental matter that underpins the resilience and sustainability of our health systems, the health and care workforce. Recognizing their vital role in building and maintaining robust health systems, we acknowledge their dedication and sacrifices of our health and care workers in meeting the needs of our populations. As our Minister of Health, Professor Alexandru Rafila, has stated in his statement on the first day, we were honored to be the host country for this year's high-level meeting on health and care workforce, in which the Bucharest Declaration on Health and Care Workforce was signed as a vital commitment following the Health and Care Workforce Time to Act report presented during the last year RC in Tel Aviv. Also, during the high-level regional meeting, the framework for action was firstly widely introduced to member states by colleagues from the WHO Regional Office for Europe. Allow me to use the opportunity and sincerely thank our RD, Dr. Hans Kluge, Dr. Natasha Zopardi-Muscat, Dr. Thomas Zapata and the entire team, Chris, Yana, Maggie, for their commitment to the health and care workforce work and the great collaboration with member states. Consequently, after the Bucharest meeting, Romania, in collaboration with Serbia, Malta, Kazakhstan, Norway, Israel, and Slovenia, has taken the lead in drafting a resolution and in facilitating the subsequent comprehensive consultation process, which included multiple informal consultations earlier this year throughout the summer. We would like to express our utmost gratitude to all member states for taking active roles in this process and for all the valuable contributions which enrich this technical document. We would like also to commend and publicly appreciate the constructive and positive spirit and engagements of our member states, which allowed for a consensus draft to be proposed for our adoption today. It was indeed a true collective effort, and we highly appreciate it. The resolution before us, titled Framework for Action on the Health and Care Workforce in WHO European Region 2023-2030, represents a comprehensive response to the presenting challenges facing our health and care workers. This draft resolution, drafted by member states, agreed by member states, co-sponsored by multiple member states, embodies our collective commitment to address workforce realities, inequalities, migration challenges, and the imperative to enhance training opportunities. In the spirit of collaboration and partnership, we urge all colleagues, all member states to unite in endorsing the resolution and embark together as member states at a whole of government level, together with the NSAs, together with academia, with civil societies, with all stakeholders, and with the guidance of the WHO, in a journey to prioritize strategic actions guided by the outlined pillars of this framework. Thank you.
Thank you. Thank you very much, Romania, for chairing this process. And next, I would like to give the floor to Switzerland.
Vielen Dank. Sehr geehrter Regionaldirektor, sehr geehrter Exekutivpräsident des Regionalkomitees, sehr geehrte Delegierte. Wie bereits mehrfach erwähnt, stehen wir weltweit und auch in der europäischen Region vor einer erheblichen Krise in Bezug auf das Gesundheits- und Pflegepersonal. Wir wissen, dass das Gesundheits- und Pflegepersonal entscheidend ist für die Sicherstellung der Widerstandsfähigkeit der Gesundheitssysteme, damit diese in der Lage sind, qualitativ hochwertige Gesundheitsversorgung zu gewährleisten, auch und vor allem in gesundheitlichen Notlagen. Die Schweiz erachtet diese Voraussetzung als unabdinglich, um die Patientensicherheit zu gewährleisten sowie den bestmöglichen Gesundheitszustand sicherzustellen. Wie die Covid-19-Krise uns deutlich vor Augen geführt hat, sind wir als globale Gemeinschaft gegenwärtig nicht in der Lage, adäquat medizinisches Personal für langwierige gesundheitliche Notlagen zu mobilisieren. Weltweit besteht die dringende Notwendigkeit auf eine bessere Vorbereitung. In diesem Sinne begrüßen wir das Handlungsrahmen für das Gesundheits- und Pflegepersonal in der europäischen Region, der WHO, 2023 bis 2030, der uns mit unseren nationalen Entwicklungen und Prioritäten im Einklang ist. Auf nationaler Ebene wurde 2022 die Pflegeinitiative und damit das Bundesgesetz über die Förderung der Ausbildung im Bereich der Pflege vom Parlament verabschiedet. Diese hat zum Ziel, die Zahl der inländischen Ausbildungsabschlüsse zu erhöhen. Es verpflichtet die Kantone, die praktische Ausbildung in den Gesundheitseinrichtungen zu fördern. Studierende mit Ausbildungsbeiträgen zur Sicherung ihres Lebensunterhalts zu unterstützen und die Zahl der Ausbildungsplätze in den höheren Fachschulen und Fachhochschulen zu erhöhen. Abschließend möchten wir die Gelegenheit ergreifen, dem Sekretariat für ihre unermüdliche Arbeit zu dieser Thematik zu danken und freuen uns auf die Umsetzung des Handlungsrahmens. Vielen Dank für Ihre Aufmerksamkeit.
Thank you very much, Switzerland. Now I give the floor to Tajikistan. You have the floor, please.
Спасибо, уважаемый председатель, уважаемый региональный директор и участники сессии. Таджикистан хочет поблагодарить ЕРБ ВОЗ за разработку столь важного документа, как рамочная основа для действий в отношении медицинских и медико-социальных кадров в Европейском регионе ВОЗ на предстоящие 7 лет. Необходимо отметить, что данная рамочная основа для действий учитывает прежний опыт и новые визовые области обеспечения медицинских кадров. В нем четко и конкретно указаны 5 взаимосвязанных основополагающих направлений и действия государств-членов ВОЗ и действия ВОЗа, которые направлены на улучшение системы обеспечения кадровых ресурсов и медицинских услуг, особенно с акцентом в сельских местностях. Необходимо отметить, что вопрос обеспечения врачей и медсестер ранее, то есть до пандемии COVID-19, был очень актуальным, однако пандемия COVID-19 больше показала слабые места в системе здравоохранения, касающиеся набора, удержания и защиты медицинских работников. Об этом свидетельствует доклад ЕРБ ВОЗ в прошлом году в Израиле на 72-й сессии, а также принятие Бухарестской декларации о кадрах медико-санитарных и социальных работников. Уважаемые участники, несмотря на то, что в нашем регионе, то есть в европейском регионе, отмечается высокая плотность по отношению с другим регионам относительно медицинских специалистов, но нехватки еще существует, и ситуация диктует о необходимости разработки нового подхода с улучшением ситуации. И вот в этом аспекте новая рамочная основа является очень актуальным и своевременным. В Таджикистане с целью улучшения качества управления и планирования кадровых ресурсов при поддержке ВОЗ в этом году завершен комплексный анализ рынка труда в сфере здравоохранения. И мы начали работать над разработкой новой стратегической дорожной карты. В текущем году с учетом и с поддержкой Европейского регионального бюро ВОЗ мы провели политический диалог с участием ключевых специалистов из ЕСБР ВОЗ, это Наташа Азапарти, Томас Запату, а также всех международных организаций, которые работают в Таджикистане, такие как Азиатский банк развития, Всемирный банк, Исламский банк, GIZ, ЮНИСЕФ и другие организации, а также в этом совещании участвовали руководители Министерства финансов, Министерства образования и науки, Министерства торговли и экономического развития, Минтруд, Комитет по делам женщин и руководители областных структур подведомственных Министерства здравоохранения. Хочу отметить, что вопрос улучшения кадровых ресурсов.
Прошу прощения, Таджикистан, пожалуйста, финализируйте вашу речь. Время на исходе.
И в конце хочу отметить, что у нас с целью обеспечения в последние 8 лет была открыта 10 медицинских колледжей и 1 медицинский университет, и в последние 8 лет количество выпускников медвузов на 70% и медсестер на 2 раза было увеличено. Доля врачей моложе 55 лет составляет 78%. И в конце хочу отметить, что Таджикистан поддерживает проект резолюции, предлагаемой рамочной основой для действий в отношении медицинских кадров, и Мы надеемся, что данный документ будет способствовать решению нехватки кадровых ресурсов на национальном и на региональном уровне.
Спасибо большое, Таджикистан. Следующее слово предоставляется Турции. Next, Turkey, you have the floor.
Thank you, Chair. I would like to thank the Secretariat for the framework for action and the countries for contribution to the resolution. Turkey has been a supporter and co-sponsor of the resolution from the beginning. In order to save time, I will briefly mention a good practice from Turkey. Health Minister of Turkey has established a series of actions called White Reform, which improves the financial situation of healthcare workers, proposes legal actions to overcome violence against health and care workforce, advances the working conditions, and improving the legislation about malpractice cases which causes health and care workers to stay back. I hope this framework can be implemented successfully in our region and we can create an ideal working environment for all health and care workers. I thank you.
Thank you very much, Turkey. And the next, I'll give the floor to Lithuania, following by Luxembourg. Lithuania, you have the floor.
Thank you, Chair. Lithuania fully aligns itself with the statement made by Spain on behalf of the EU and its member states. Healthcare workers form the foundation of any health system, ensuring equitable access to quality services. We acknowledge the growing need for healthcare workforce capable of addressing changing health needs tied to aging population, chronic diseases, evolving expectations, technology, and health threats from climate change and health emergencies. With regard to these challenges, Lithuania strongly supports the proposed WHO framework for the health and care workforce in the WHO European region, featuring 5 comprehensive and interconnected pillars. Lithuania has already initiated significant efforts within these pillars, which include elevating the status of professional qualifications, enhancing psychological well-being of healthcare professionals, improving working conditions, facilitating ongoing professional development and streamlining the tasks shifting between healthcare practitioners and nurses, improving healthcare workforce forecasting and planning system, and initiating complex measures for tackling unequal distribution of healthcare professionals throughout the country. It's encouraging to note that these objectives laid out by the WHO's framework closely align with Lithuanian current needs and actions. While pursuing these priority actions, we see promising opportunities such as network transformation, WHO support, stakeholder collaboration, and political commitment. Lithuania stands ready to work together with the WHO European region and other member states in successfully implementing this framework. Thank you.
Thank you very much, Lithuania. Now I give the floor to Luxembourg, following by Monaco. Please.
Honorable Président exécutif, honorables délégués, le Luxembourg s'associe pleinement à la déclaration prononcée par l'Espagne au nom de l'Union européenne et à celle prononcée par Malte au nom de l'initiative des pays de petite taille de la région européenne de l'OMS. Des mesures urgentes sont nécessaires pour retenir les travailleurs de santé et de soins, en particulier dans les zones rurales et mal desservies, pour protéger leur santé mentale et physique et leur bien-être en général, pour améliorer leur recrutement et pour adapter l'offre de travailleurs de santé et de soins, non seulement aux besoins actuels, mais également futurs. Les travailleurs de santé et de soins sont l'épine dorsale de tout système de santé, car l'égalité d'accès à des services de santé et de soins de qualité pour la population dépend largement de l'existence d'une main-d'œuvre adaptée. Ainsi, nous reconnaissons la nécessité de disposer d'un personnel mieux préparé pour faire face à l'évolution des besoins en matière de santé due au vieillissement des populations, à l'augmentation des maladies chroniques, à l'évolution des attentes des patients et aux nouvelles technologies, ainsi qu'aux menaces sanitaires croissantes associées au changement climatique et aux situations d'urgence sanitaire. Par conséquent, le Luxembourg soutient fermement l'adoption du cadre d'action relatif au personnel de santé et de soins dans la région européenne de l'OMS pour 2023-2030 et salue les efforts de collaboration des États membres qui ont participé à la formulation et à la négociation de la résolution. En outre, nous réaffirmons notre engagement envers les principes énoncés dans la déclaration de Bucarest. La pandémie nous a douloureusement montré que pour un pays de petite taille, les professionnels de santé sont l'un des éléments les plus critiques du système de santé et que leur absence, même transitoirement dans le contexte d'une crise, peut avoir des conséquences dévastatrices. Vu les particularités des pays de petite taille et notamment leur dépendance fréquente de pays voisins, le Luxembourg a toujours contribué activement aux différents développements sur les ressources humaines en santé dans le cadre de l'initiative OMS Europe des pays de petite taille. Garantir la disponibilité des professionnels en nombre et qualité suffisante tout en visant une plus grande autonomie nationale est donc l'une de nos priorités. Une adaptation de notre cadre légal des professions de santé aux besoins d'une médecine en pleine évolution, y compris pour de nouvelles professions en voie d'apparition, est aussi rapidement nécessaire. À cet égard, et dans le contexte d'une mobilité intra-européenne croissante des professionnels de santé, le Luxembourg plaide pour une approche législative cohérente entre les différents pays européens. Merci pour votre attention.
Thank you very much, Luxembourg. And next, I'll give the floor to Monaco, following by Israel. Please, you have the floor.
Merci, Monsieur le Président. La Principauté souscrit à la déclaration faite par Malte au nom de l'initiative des petits États. Nous tenons également à réitérer notre plein soutien à la résolution sur le cadre d'action pour les personnels de santé et d'aide à la personne, qui pose la base pour trouver des solutions efficaces et durables aux difficultés rencontrées par les personnels de santé et d'aide à la personne en Europe. Nous remercions la Roumanie pour son leadership à cet égard. En braquant les projecteurs sur nos systèmes de santé, la pandémie de Covid-19 a mis en lumière ces difficultés, parmi lesquelles on peut citer l'épuisement professionnel, le stress et un ensemble de préoccupations liées à la sécurité et à la violence sur les lieux de travail. Au niveau national, Monaco attache une importance particulière à l'environnement de travail et aux conditions d'emploi des travailleurs de santé et d'aide à la personne. D'une part, la Principauté veille à garantir des modes de rémunération justes, et d'autre part, elle applique une réglementation stricte en vue d'empêcher et de punir toute forme d'abus et de violence en milieu professionnel. Deux lois sont notamment en vigueur à cet égard. L'une, de 2011, porte sur la prévention et la répression des violences particulières, et l'autre, de 2017, porte sur le harcèlement et la violence au travail. La pandémie de Covid-19 a également mis en évidence de nouvelles réalités, comme l'importance pour les personnels de santé de pouvoir recourir à des solutions numériques pour traiter les patients de manière optimale. À ce titre, les établissements de santé de la Principauté sont équipés de technologies de pointe qui permettent notamment une meilleure gestion des ressources humaines et de meilleures performances du personnel sur le plan médical. En bref, les 5 piliers sur lesquels repose le cadre d'action, à savoir fidéliser et recruter, étoffer l'offre, optimiser les performances, planifier et investir, sont des priorités pour la Principauté qui continuera d'œuvrer en faveur des objectifs de développement durable liés à la santé. Je vous remercie.
Thank you very much. And next, I'll give the floor to Israel, following by Greece. You have the floor, Israel.
Thank you, Chair. First and foremost, Israel welcomes the framework for action on health and care workforce in the WHO European region and as a co-sponsor. Health and care workforce plays a vital role in building, maintaining, and ensuring robust, resilient health system and advancing universal health coverage. Healthcare and workforce also include rehabilitation services, which are key to achieving sustainable development goals, ensuring healthy lives and promoting well-being for all ages, as well as an essential part of healthcare and required to achieve the universal health coverage SDG targets. It's critical to address the challenging realities of the health and care workforce to ensure timely and equitable access to health care services. We also note, we have also note and welcome the recognition of the role of the health and care workforce during emergencies and affirm the need to guarantee its continued function. We have witnessed the systemic impact of the state of emergency on our health workforce, with personnel diverted to preparedness in the front and the hospitals absorbing a large number of casualties. This has created new need in both emergency care and long-term rehabilitation. While we have received silence from the international organizations, we have expected WHO to do better. We have witnessed an outpouring of support from health professionals from around the world, with over 10,000 volunteers offering to come and aid our health system and the people of Israel. Those volunteers constitute an essential pool of resources that can be called upon should we experience further restraint with our health system. I would like to extend thanks on behalf of the people of Israel for those brave volunteers' willingness to assist through the Israeli Ministry of Health Medical Volunteers for Israel initiative. Thank you for standing with Israel in its time of need. I thank you.
Thank you very much, Israel. Now I will give the floor to Greece, following by United Kingdom.
Thank you very much, President. Good morning to all of you. I've been part of the resolution, and Greece has been part of the resolution, and we're very much standing behind it. And we definitely need more healthcare personnel, both because there is a burnout and there are fewer people, but also because the healthcare needs in the future across the region will be far more because we're growing older, there's more mental disease, so we have a lot of challenges ahead, even if there is no more pandemic or more crisis. So we certainly need to attract more personnel to healthcare and make them feel happy. We do, however, face problems because we have the rights of the healthcare personnel to a decent salary, to a decent healthcare condition, work conditions, but we also have very big differences as far as pay goes between country and country, and we are allowing mobility, and we should, because doctors and nurses have rights, but it's very difficult to balance the rights of the personnel to the rights of the people, because, for example, I was at a meeting recently, and a health minister from Europe said, we're getting doctors from India. And okay, we get doctors from India, but that's not a solution to the problem. I live in a country where most of our doctors flee the country after they graduate and work with far better pay and better conditions in other European countries. So we have to balance this, and young doctors and young care personnel are entitled, and they feel they have privileges, and they want to live in a city, they want to have a good lifestyle, they don't want to work too long hours overtime, which is fair enough. And on the other hand, people very rarely want to live on islands, provide healthcare for less areas that have less access. So we really need to think how we can have equitable access, not just to the doctors or the patients, but also to healthcare across Europe, because the needs are very different. So we have to start from school, tell people that they have the rights, but also that they need to give back. For example, our doctors and nurses in Greece study for free. So it is a major investment of the country, and then they leave the country. Fair enough, but on the other hand, the country needs the doctors. So we do need to find a solution, stand by mobility, stand by the rights of healthcare personnel, but also stand by the rights of every patient wherever they live in Europe and the world, so that we can really have a system where there is equity in healthcare everywhere. And I think that is important. So starting from school, giving people a right to better working conditions, but also the feeling that they do also need to give back to society and patients. Thank you.
Thank you very much, Greece. Now I give the floor to United Kingdom, following by Norway. Please, you have the floor.
Thank you, Executive President. The UK welcomes the new framework, which reflects the challenges we all face in building and maintaining a public health and care workforce, which meets the needs of our populations whilst we seek to harness the latest technologies for health and continue to recover from COVID-19. We thank Romania for chairing this resolution, and I'm pleased to confirm that the UK is very pleased to join the consensus on this text. The importance of workforce is reflected in the UK government's long-term plan for workforce for our National Health Service. Our plan sets out the steps the NHS and its partners need to deliver a workforce that meets the changing needs of our population over the next 15 years. It aims to put the workforce on a sustainable footing for the long term. It is a priority for the UK government that we are backing this plan with significant increases in education and training places and introducing greater flexibility for flexible working opportunities and childcare support, all of which aims to improve staff retention. Our workforce plan envisages a reduction in the proportion of overseas recruitment over time, but there will continue to be a role for international recruitment, and we're committed to doing so within an ethical framework. Our Code of Practice for International Recruitment guarantees stringent ethical standards when recruiting health and social care from overseas. It aligns with the WHO Health Workforce Support and Safeguards list, and it ensures that transparency, fairness and health system sustainability are embedded in all of our international recruitment. As the framework also highlights, we need to start working differently and make sure service delivery keeps up with technological advances such as AI and robotic-assisted surgeries. But staff will remain the greatest asset of our health and care systems right the way across the region. It is vital that they have appropriate support in place and that they feel valued. It is right, therefore, that this is a central pillar in both our NHS long-term plan and the WHO Euro-region framework. Thank you, Chair.
Thank you very much. Next, Norway, following by Hungary. Please, you have the floor.
Thank you, Chair. President, Regional Director, dear colleagues. Norway supports the framework as it has been proposed. I would like to commend Romania and the Regional Office for their excellent work in developing this important document. In Norway, an official independent report addressing our health and care workforce was presented this year. The report illustrates that, as in many other countries, shifting demography means there will be fewer health professionals per patient in the future. In accordance with the WHO Global Code of Practice on the international recruitment of health personnel, our domestic report does not recommend recruitment of health personnel from abroad to resolve our challenges. Rather, multiple measures need to be implemented. The framework emphasizes important aspects such as the retention of health and care personnel, the health and welfare of our workforce, as well as digital tools and education that match the needs of the services. We believe that the proposed framework can be an important tool for taking on one of the key challenges for our health and care system, namely maintaining and developing our workforce. The health and care workforce is vital to achieving the goal of universal health coverage. This will be a priority area for Norway when we assume our seat in the executive board. Thank you.
Thank you very much, Norway. Next, I will give the floor to Hungary, following by Slovenia.
Thank you, Chair. Distinguished Regional Director, dear colleagues, we welcome the framework for action on the health and care workforce that identifies key issues and provides guidance on challenges Hungary is also facing. Our main priorities include recruiting and retaining human resources, reinforcing continuous professional development, and recruiting staff with new knowledge and competencies, provide adequate working conditions, and improve the mental health of healthcare workers, as well as strengthening health information system and collect and analyze better data. Hungary is also increasingly affected by out-migration of health and care workers. The recent measures have focused on recruiting and retaining the workforce. The Hungarian government has taken several measures in recent years to ensure that an adequate professional workforce available for provide quality health services. We have been considerably raising the wages of doctors and health professionals, aiming at improving the pay gap. High-quality, practice-oriented university education is free of charge. We have introduced a resident support program as well as scholarship for healthcare professionals to support us entering training. Regarding Pillar 2, Hungary is placing emphasis on widening the competencies of care workers in order to use the skills they have acquired at their higher education. To optimize the performance as GPs, the government has recently restructured GP practices for efficiency and increased time for patient care. To answer question 2, WHO support for the collection and sharing of good practices, facilitating the exchange of practical experiences between member states may contribute to implement national programs. The collection, analysis, and evaluation of data by WHO and sharing them with member states will also help to guide implementation. Thank you for your attention.
Thank you very much, Hungary. Next, Slovenia, following by Germany. Slovenia, you have the floor.
Thank you, Chair. Slovenia aligns itself with the statement made by Spain on behalf of the EU and Malta on behalf of the Small Countries Initiative. We would like to thank the Regional Director for the framework, the report, and for the guiding questions so that we can provide additional guidance. We would also like to thank Romania for championing the resolution which Slovenia, as part of the core group, wholeheartedly supports. Health and care workforce is one of the most pressing issues in our country at the moment. The main priority for Slovenia is the recruitment and retention of health and care personnel. We see a migration of workers to other countries as well as other occupations, and this has been exacerbated by the recent pandemic. We need solutions for the short term, as well as comprehensive planning and policies for the long term. In order to be successful, we must ensure that the health workforce is appropriately involved when assessing their needs and developing solutions. More than 70% of the health workforce are women. Therefore, we should better involve them in decision-making. What matters the most in implementation is the ownership of proposed changes by those affected. We also see much value in investing in continuous capacity building of our health workforce in order to ensure the best possible quality of care. Finally, we see the value of reaching beyond the traditional health sector to find human resources for health. Communities and civil society have a key role to play in reaching health goals, and the formal health sector needs to better connect and partner with them. We strongly encourage more support and capacity building in this area for effective and meaningful social participation for health and well-being. Thank you.
Thank you. Thank you very much, Slovenia. So next, Germany, following by Croatia.
Vielen Dank, Herr Vorsitzender. Guten Morgen alle zusammen. Deutschland schließt sich natürlich vollumfänglich dem Statement der EU an. Deutschland würdigt den vorgeschlagenen neuen Handlungsrahmen für das Gesundheits- und Pflegepersonal in der europäischen Region. Er ist ein zentraler Schritt zur Sicherung eines nachhaltigen Gesundheitsfachkräfteangebots. Gesundheits- und Pflegeberufe sind die Grundpfeiler einer qualitativ hochwertigen und flächendeckenden Grundgesundheitsversorgung. Sie stehen aktuell nicht zuletzt durch die Pandemie, aber auch durch den spürbaren Struktur- und demografischen Wandel vor besonderen Herausforderungen. Diese Herausforderungen können wir nur meistern, wenn wir über ausreichend Personal verfügen, das bestmöglich qualifiziert, effizient und motiviert wichtige Versorgungsaufgaben erbringen kann. Ich möchte insbesondere auf 3 Säulen und damit verbundene Maßnahmen hinweisen, die aus deutscher Sicht zentral sind. Die Säule Nummer 1: Die Bedürfnisse und das Wohlbefinden der Beschäftigten im Gesundheitswesen und der Pflege müssen stärker berücksichtigt werden. Durch die Schaffung besserer Arbeitsbedingungen sowie den Ausbau der beruflichen Weiterentwicklungsmöglichkeiten sollen sich auch in Zukunft genügend Menschen für die Berufe des Gesundheitswesens entscheiden. Hier sind insbesondere die Arbeitgeber und Führungskräfte in den Einrichtungen gefordert. Sie können durch Gewährleistung einer attraktiven Arbeitsplatzkultur und Förderung Vereinbarkeit von Beruf und Familie zu einer langfristigen Mitarbeiterbindung beitragen. Säule Nummer 2. Ziel sollte sein, dafür zu sorgen, dass mehr qualifizierte und motivierte Menschen in den Gesundheits- und Pflegeberufen arbeiten. Zu diesem Zweck ergreift Deutschland aktiv Maßnahmen, um Karrierechancen zu verbessern. Beispiele hierfür sind die Erweiterung der Fähigkeiten und Kompetenzen in den Berufen, zum Beispiel durch Integration der selbstständigen Ausübung von Heilkunde in die hochschulische Pflegeausbildung. Säule Nummer 3. Vor dem Hintergrund der meist komplexen medizinischen, pflegerischen und therapeutischen Versorgung sind strukturierte, interdisziplinäre, integrative und vor allem kontinuierliche Konzepte zur Leistungserbringung gefordert. Diese müssen sich an den individuellen Bedürfnissen und Bedarfen der Menschen ausrichten. Deutschland bringt hierfür eine auf den Gesundheits- und Pflegebereich bezogene Fachkräftestrategie auf den Weg. Wichtige Punkte sind hierbei die Ausbildung und Arbeitsbedingungen, die zunehmende Digitalisierung im Gesundheitswesen und Veränderung von Versorgungsstrukturen. In diesem Zusammenhang begrüßen wir ausdrücklich die in der Resolution bekundete Absicht, dass die WHO Europa den Mitgliedstaaten die aktuellsten Erkenntnisse, Empfehlungen und Erfahrungen zur Wirksamkeit von unter den 5 Säulen des Handlungsrahmens ergriffenen Maßnahmen bereitstellen und den weiteren Prozess begleiten wird. Ich danke vielmals.
Thank you very much, Germany. Next, Croatia, following by Belgium.
Thank you, Chair. Distinguished Regional Director, Excellencies, colleagues. Croatia aligns with the statement of the European Union and its member states. We recognized an urgent need to address new health and care workforce realities. Since the beginning of the COVID-19 pandemic, Croatia has actively participated as a co-leader in the consultations for the action plan and resolution for the health and care workforce in Geneva, adopted at the RC73, and as a member of the core group of the Euro member states in the process of preparation of the framework for action on the health and care workforce in the WHO European region 2023-2030, which will enable a new course of action for the next 8 years. Croatia considers the importance of the additional elements of the documents is the improvement of the strategy of strengthening support for health workers, especially in activities based on experience from the COVID-19 and recent emergency health events due to natural disasters. Also, Croatia recognized that advancing health and care workforce education is playing a pivotal role in global health preparedness and response efforts. We envision a huge potential of the World Health Academy for the improvement of this process. We fully support the activities of WHO Euro Office, and we also recognize the importance of adopted documents, and we establish a cross-governmental working group at the national level, which will actively participate in the future implementation of the framework for action at the national level, in order to secure a full recovery from the pandemic and greater capacity to respond to current and future health and care needs. Thank you.
Thank you very much, Croatia. Next, Belgium, following by Bulgaria.
Thank you, Mr. Chair. Belgium aligns itself with the statement delivered by Spain on behalf of the European Union and its member states. All countries are struggling with this paramount issue, which has been exacerbated by the COVID pandemic. We thank the regional office for its guidance on how to address the health and care workforce supply problem. We would like to underline 4 important issues. Firstly, maintaining sufficient workforce capacity requires sustained and cost-effective investments. We encourage WHO to continue making the case for investment in health workforce to the other ministries, including ministries of education and of finance. Secondly, we need more precise data and indicators regarding health workforce for forecasting and planning strategies. For instance, we should develop a better view on job retention or inflow of foreign trained health workers. This requires a better view on the activity of trained health professionals outside the healthcare sector. And thirdly, we should remain realistic in our ambition. The WHO European region is said to currently face a shortfall of 1 million health workers, and that number is expected to double by 2030. Due to our aging population, there are substantial limitations on the potential to increase the health and healthcare workforce. We should be honest about this and reflect deeply on how we can continue to provide high-quality healthcare to all in this context. Therefore, we welcome the proposed actions such as for redefining teams and skill mix, as well as for smart use of digital solutions. But we do believe that rethinking the organizational models of current healthcare systems needs much more attention. Finally, to improve healthcare's attractiveness, we need also to address gender equity. Men still dominate leadership roles in healthcare, while nursing remains predominantly a female profession. In our view, acknowledging and addressing this will create a more balanced system. Thank you, Mr. Chair.
Thank you very much, Belgium. Now, Bulgaria, following by Iceland, please.
Honorable Chair, distinguished Regional Director, colleagues, Bulgaria aligns itself with the EU statement made on behalf of the EU member states. Human resources in the health sector in Bulgaria face the same challenges as other European countries: an aging population and therefore an aging workforce in the health sector, insufficient attractiveness of some health professions for the younger generations, uneven territorial distribution as a result of internal migration from smaller to larger settlements, migration of health workers in the EU and beyond. The main challenge for human resources in healthcare in Bulgaria is the insufficient number of nurses across the country, as well as unbalanced territorial distribution of doctors and declining attractiveness of certain specialties. There are regional imbalances in the number of doctors for the population, which follow the territorial disproportional distribution of the population as a whole, mainly driven by difference in socioeconomic conditions and quality of life between different areas. In addition, the way of funding in different specialties creates incentives for young doctors to choose specialties that are better paid with greater prestige with better professional opportunities. Bulgaria supports the objective and 5 pillars of the action set out in the proposed framework for action and values the consultation of previous regional meetings in the issue in the period February-March 2023. We recognize that the program enhances progress towards strengthening national health personnel in order to better meet the needs for the population for medical and social assistance through investment in the effective and working health and care workforce. We support the proposed actions and believe that they contribute to the implementation of European Work Programme 2020-2025, including flagship initiatives such as primary healthcare, emergency preparedness, and healthcare for refugee migrants. We also support the draft resolution targeted at comprehensive actions to ensure and develop the health and care workforce. We consider it essential to invest in training a sufficient number of health workers based on database planning, strengthening the management capacity of entities leading the human resources management processes in healthcare, creating conditions for collective, accurate, and complete data on human resources and areas in the decision-making process. We share the importance of cooperation between health, finance, education, labor, and social policy sectors, as well as the involvement of other stakeholders, mindful that achieving the optimal workforce in healthcare is a complex institutional program. Thank you.
Thank you very much, Bulgaria. Next, Iceland, following by Denmark. Please, you have the floor.
Honorable Chair, Regional Director, delegates, I would like to start by thanking the Secretariat and colleagues from other member states for the work on the framework, which we strongly support, and align ourselves with the statements made by the EU and the small countries initiatives. But today, I am furthermore taking the floor motivated by the nationwide one-day strike in Iceland earlier this week against inequality and sexual violence, a movement embraced by tens of thousands of Icelandic women, including our female Prime Minister and non-binary individuals. In line with this, I would like to draw attention to Pillar 1 of the framework, focusing on retention and recruitment of health and care workforce. We believe that there is a need to intensify efforts to bridge the gender pay gap, establish policies and practices that combat gender inequality, and enforce a zero-tolerance policy for abuse and violence. Iceland has consistently been viewed as a world leader in the fight for gender equality, and has for the past 14 years consistently ranked #1 on the World Economic Forum Gender Gap Index. However, challenges remain. The gender wage gap in Iceland in some sectors is still as high as 21%, and studies reveal that over 40% of Icelandic women have been subjected to gender-based or sexual violence. To address this, in addition to raising, of course, the awareness of the issue, we are implementing a standardized procedure within our healthcare institutions to ensure comprehensive care to survivors of gender-based violence. Europe has the highest gender parity across all regions, but there is still room for improvement. Thank you for your attention.
Thank you very much, Iceland. Next, we give the floor to Denmark, following by Russian Federation. Please, Denmark.
Thank you, Chair. Denmark aligns itself with the statement made by Spain on behalf of the European Union and its member states. Denmark welcomes the framework on the health and care workforce in our region. We are proud to co-sponsor the resolution, and we thank Romania and WHO Euro for hosting the Bucharest meeting on health and care workforce. Health professionals are the backbone of our health systems, but like many other countries, Denmark is facing staff shortages and a growing number of patients with complex health needs. A National Commission for Health System Resilience launched their final report this autumn. Overall, the Commission concludes that we need to prioritize better in order to be more efficient. We need to work smarter and free up time for core tasks, and we need to improve the working environment for our health professionals. These recommendations are very much in line with the pillars of the regional framework. There is no one-size-fits-all solution, but we all have to take new approaches in order to make our health systems more resilient and sustainable. This will require more widespread use of digital solutions, strategic workforce planning, and patient empowerment. We encourage WHO to continue to support member states in developing such new approaches with a strong focus on prioritization and planning. Denmark fully supports the adoption of the framework, and we stand ready to collaborate and to share our experiences and lessons learned with WHO and member states. Thank you.
Thank you very much, Denmark. Now I give the floor to Russian Federation, following by Slovakia. Please, you have the floor.
Уважаемый господин председатель, уважаемые коллеги, выражаем признательность всем участникам разработки представленной резолюции под председательством Румынии и Европейского регионального бюро ВОЗ за транспарентный процесс и эффективные консультации. Поддерживаем принятие данной резолюции. Осознаем важность своевременной подготовки трудовых ресурсов здравоохранения в целях обеспечения всеобщего охвата услугами здравоохранения. Повестка развития медицинского образования в первую очередь должна включать реализацию государственных мер по устранению кадрового дефицита, прежде всего в первичном звене здравоохранения и трудоустройству молодых специалистов. Российская Федерация уделяет первостепенное значение подготовке медицинских специалистов как для покрытия собственных нужд, так и в рамках помощи иностранным государствам. В Российской Федерации работа по подготовке кадров здравоохранения проводится бесплатно за счет средств федерального бюджета. В условиях постоянного прогресса технологий очевидным, на наш взгляд, становится процесс непрерывного образования кадров здравоохранения. Для этих целей в Российской Федерации функционирует интернет-портал непрерывного медицинского образования, который позволяет как российским, так и зарубежным специалистам актуализировать свои знания. Особое значение данный портал приобрел в период пандемии новой коронавирусной инфекции, позволивший в кратчайшие сроки осуществить переподготовку 10 тысяч медицинских работников. Важно отметить, что в период пандемии специалисты из целой группы стран имели возможность воспользоваться образовательным ресурсам. Активно используем цифровые технологии в подготовке специалистов. В Российской Федерации функционирует Федеральный реестр медицинских работников, который за несколько лет с момента своего основания стал полноценной информационной системой, позволяющей, с одной стороны, иметь актуальные данные о кадровом потенциале отдельных медицинских учреждений, а с другой стороны, осуществлять планирование кадровых ресурсов здравоохранения в целом по всей Федерации. В Российской Федерации проходит обучение в области здравоохранения несколько тысяч иностранных специалистов за счет средств гранта, предоставляемых Российской Федерацией. Для эффективной реализации рамочной основы в регионе и устранения кадрового дефицита, а также неравномерного распределения медицинских специалистов, полагаем целесообразным при координирующей роли ВОЗ осуществлять обмен опытом и решениями, доказавшими свою эффективность. Благодарю за внимание.
Thank you very much, Russian Federation. Now I give the floor to Slovakia, following by Ukraine. Please, Slovakia.
Thank you very much, Executive President, for the floor, dear Regional Director, Excellencies and colleagues. Slovakia aligns itself with the statement of Spain made on behalf of the EU and its member states on this agenda item, and we fully support adoption of this agenda. Slovakia is well aware of the vulnerability of the health system of our country, but also in the entire region. We believe that without international collaboration and cooperation and effective research in the field of behavior and cultural specifications, improvement of the data collection and evaluation through the National Health Information System strengthening as the basic prerequisites of the development of the sets of the strategies in this era at the national level, there will be really best achievement not very soon observed. Evidence with the good examples of the models of innovative solutions and in sharing good practices on how to work better in the field of the education and creating conditions of the safe work environment for medical personnel together with their protection against disinformation and misinformation campaigns, which we recognize as the important risk factors for earlier and higher burnout syndrome and failure to continue in their work among the specific groups also in Slovakia. Slovakia, thanks to WHO and member states involved in development of this framework, especially Romania, for working in the region in line with the EU position in this area. And at the same time, we would like to point out that when considering the specific settings of the framework, we need to take into consideration also very special needs for the mental health and also trauma-informed services for health workforce. Even prevention of the mobbing and trafficking within the traveling for the work reason across the region. This is a phenomenon which is very often neglected and marginalized in our region and national strategies and frameworks. We encourage also to incorporate stronger collaboration in preparation phase for the adoption of this agenda, but also implementation of different strategies on national levels with ILO and other social organizations on the national and regional level to prevent also discrimination with the modification of the legislation related to patient safety and its impact, which is really huge and very often is really left behind. We know that safety and safety of the patient safety is a very specific area where we can not only encourage to improve the strategies for support of the healthcare workers, but also to decrease the additional costs and improve the investment.
Please finalize your statement.
Thank you very much, Chair.
Thank you so much, Slovakia. And last, I will give the floor to Ukraine. Please, you have the floor.
Thank you, dear Chairman. The full-scale war initiated by Russia against Ukraine has been ongoing for more than 20 months. Since the first day, Russian invaders have committed war crimes against civilians, killing innocent people, and intentionally continue to destroy Ukrainian medical infrastructure. Specifically, among the medical infrastructure, the enemy has completely destroyed 190 healthcare facilities and damaged 1,449 objects, including maternity hospitals, civil hospitals, first care facilities. The healthcare system is primarily about people. Medical professionals who since the morning of February 24, 2022 continue to treat patients, save their lives, vaccinate them and restore patients to health. They persist in doing so even amidst power outage and shelling every day of the year. Due to the war, more than 100 civil medical workers have lost their lives on the job, and thousands have been injured. A young doctor who started working in Kherson hospital after internship was killed on the first day of his work, August 1st this year. Thousands of medical staff were injured but continue working in constant shelling. Ukrainian healthcare workers have been forced to move the safer regions and find new places to work. Our 5,000 medical professionals have changed their place of residence and continue to provide medical care. More than 700 doctors and nurses from more than 50 countries of the world work with Ukrainian physicians hand by hand, such as Butterfield and Civil Hospital on all regions of Ukraine. And we are thankful so much to each of them personally. Despite the war, we continue to improve the educational process for training highly qualified medical personnel, plan human resources efficiently, enhance the skills of healthcare professionals, and implement modern diagnostic and treatment technologies. The Ministry of Health of Ukraine adheres to the main goals set by the World Health Organization in the Global Strategy on Human Resources for Health until 2030. We express deep gratitude to the Office of the World Health Organization and to all countries, our friends and partners, for support and assistance to Ukraine. Thank you for your attention.
Thank you very much, Ukraine. Thank you very much, all the member states. And in total, we've got 23 remarks from the member states. And now I am inviting our international partners if they would like to take the floor. So, IFRC, please, you have the floor.
Thank you, Chair. Distinguished Executive President, esteemed Regional Director, dear delegates. The International Federation of Red Cross and Red Crescent Societies Regional Office for Europe thanks the WHO Euro and the co-sponsors for bringing this vital resolution and the framework to this committee. The IFRC wholeheartedly supports the 5 pillars of the framework, and we pledge to promote their intentions in our work with our national Red Cross and Red Crescent societies that have a particular role as auxiliaries to their public authorities in the humanitarian field, including their ministries of health. The IFRC and its global network were at the forefront of responding to the COVID-19 pandemic. Under the coordination and support of the IFRC Secretariat, we reach hundreds of millions of people, focusing on 3 operational priorities: sustaining health and water, sanitation and hygiene, addressing socio-economic impacts of the pandemic, strengthening a localized and community response through our national societies network. We helped strengthen healthcare systems and procured and distributed essential medical supplies, personal protective equipment, and testing kits. We supported public health campaigns to inform and engage with communities about infection prevention measures. We transported people to hospitals, cared for patients in health facilities, and provided mental health and psychosocial support. We ran vaccination drives supporting 161 million people to get vaccinated against COVID-19. As local actors at the heart of humanitarian response, we are a first-hand witness to the devastating effects of the pandemic on the health workforce through the damaging cycle of healthcare backlog, exhaustion, ill health, and absenteeism. Esteemed Chair, the IFRC particularly welcomes operational paragraph 3, element D, highlighting the vital role of protecting healthcare staff from harassment and violence, and element E, reminding us of the importance of protecting the mental health and well-being of the healthcare workforce. In 2019, at the 33rd International Conference of the Red Cross and Red Crescent, where our movement meets the 196 state parties to the Geneva Conventions, states and the Red Cross Red Crescent movement called for increased measures to protect and promote the mental health and psychosocial well-being of staff and volunteers who are responding to humanitarian needs across all sectors, equipping them with necessary skills, tools, and supervision to cope with stressful situations and responding to the specific mental health and psychosocial needs. In this context, the IFRC underscores the indispensable role the community-based health workforce plays in the multi-sectoral delivery of primary health care on our road to universal health coverage. The community health workers are pivotal in creating trust in the community and should enjoy the same protective measures
Red Cross, please finalize your statement.
as other segments of the workforce. IFRC offers its dedicated collaboration to WHO and the states. I thank you.
Thank you very much. Now, I don't see any other international organizations willing to take the floor. And now we are approaching to the non-state actors. And the Secretariat has received requests from a number of non-state actors to take the floor. And as we are already overlapping with our coffee break time, so I would ask all the speakers to consider to be fitted in the time limit. So I would like first to invite Professor Zalika Clemens from the World Organization of Family Doctors, WONCA, to deliver a joint statement on behalf of WONCA, IAHPC, IFMSA, ESPEN, IDF, ENSP, EUPHA, EFA, and EuroHealthNet. So, Professor Zalika Clements, you have the floor.
Thank you very much. Esteemed Chair and Regional Director, distinguished delegates, WONCA Europe, with the supporting NSA organizations, urge policymakers to endorse initiatives aimed at alleviating the burden on primary care health workers and effectively resolving the scarcity of primary healthcare personnel. This will lead to better patient outcomes and a stronger primary care foundation. We propose to boost workforce by recruiting more primary care professionals through expanded training, capacities, and incentives, implement better working conditions by improving work environments to prevent burnout, implement team-based care through utilizing collaborative models for efficient and comprehensive patient treatment involving doctors, nurses, physician assistants, and other health professionals. Implement digital health integration by utilizing technology to extend primary care services, especially in underserved areas. Stimulate research and innovation in primary care. Scale up education and raise awareness on the importance of primary care for population health. Enable sustainable practices by addressing overdiagnosis and over-medicalization and streamline processes to conserve resources. Simplify administrative tasks through automation to prioritize patient care. Stimulate work-life balance by implementing policies for reasonable work hours and continuous education to support professionals. Thank you very much.
Thank you very much, Professor Zalika Klemek. Now I would like Ms. Corinne Hillepen from VEMOS to develop a joint statement on behalf of European Forum for Primary Healthcare, European Public Health Alliance, International Diabetes Federation Europe, VEMOS, World Organization of Family Doctors, and the World Federation of Societies and of Anesthesiologists. So, Ms. Corinne, you have the floor.
Thank you so much. Honorable Chair, esteemed Regional Director, distinguished delegates, and dear participants. Thank you for this opportunity. We congratulate the WHO Regional Office for Europe for their landmark report, Time to Act, as well as for their efforts to mobilize 37 member states to co-sponsor the resolution on the agenda. The health workforce well deserves this prominent place on the agenda, and this framework for action clearly shows the way forward. As several civil society organizations, we would first like to highlight the following. During and after COVID-19, international health and care worker mobility became more dynamic and more complex. Some returned home, while many others left the sector or their countries for reasons like burnout, stress, and underappreciation. Migration typically favors health systems with better working and living conditions, whether real or perceived. However, these systems often have high attrition rates themselves and resort to international recruitment as an easy fix, harming the countries of origin, who for their part also fail to adequately retain their health and care workers. Since all member states face similar health workforce shortages and challenges, now and in many, many years to come, we call on member states to stop the international competition for scarce, skilled health and care workers in crisis-ridden systems, and to work together to ensure equitable availability of health and care workers across the region, and to provide them with the working conditions they need to thrive and to deliver the best possible health care for all in the region. Honourable Chair, I had 4 more specific asks, but in the interest of time, I will single out just one of them, and for the interpreters, this is number 3 on my list, and it's one that I haven't heard so much before. We also ask, we strongly urge member states to do everything in their power to boost the status and the societal appreciation of all categories of health and care workers, and to make sure they are remunerated, supported, and protected accordingly. I thank you for attention. The full statement can be read on the website, and again, apologies to the interpreters for not sticking to my text. Thank you.
Thank you very much. Thank you. And I would like now to invite Dr. Franz Wagner from the European Forum of National Nurses and Midwife Association to deliver a joint statement on behalf of the International Council of Nurses, European Forum of National Nurses and Midwife Association, and the European Nursing Students Association. Dr. Wagner, you have the floor.
Thank you, Chair. Good morning. We, on behalf of the nurses and midwives in the European region, support the resolution to adopt the framework for action on the health and care workforce in the WHO European region 2023-2030. The ICN's 2023 Recover Rebuild report corroborates WHO Euro's Time to Act report with a clear call to action. Without substantial investment in adequately supported nurses and midwives, the prospect of effectively restoring and reconstructing healthcare systems after the COVID-19 pandemic remains unattainable. In alignment with the Bucharest Declaration, we prioritize health equity, strong nursing and midwifery regulatory mechanisms, nurse and midwife education, mental health of health workers, and improving the working conditions of health workers. We call on member states to improve self-sufficiency of their health workforce, to lessen the burden of nurse and midwife recruitment from low middle-income countries to high-income countries. Member states should develop robust regulatory mechanisms to ensure the competence and professional development of nurses and midwives based on the EU directive on the mutual recognition of professional qualifications. Investment in nursing and midwifery education is required to guarantee a sustainable pipeline of skilled registered nurses and midwives. Member states should also invest in nursing and midwifery leadership, beginning with instating a government chief nursing officer, chief midwifery officer with a budget to invest in nursing and midwifery. The ICN's 2023 Charter of Change complements the WHO Euro Framework for Action, emphasizing 10 key policy actions governments and employers must take to address the critical need to invest in and protect the nursing and midwifery profession, ensuring equitable, people-centered care, safe working conditions, and recognition of nurses and midwives' roles as key contributors to high-quality health systems. Thank you.
So, and lastly, thank you very much. And lastly, could I please invite Dr. Ksenia Pachigaeva from the World Federation of Neurology to deliver a joint statement on behalf of the World Federation of Neurology, International Association for Hospice and Palliative Care. So, Dr. Pachigaeva, you have the floor.
Thank you, Chair. The World Federation of Neurology and the International Association for Hospice and Palliative Care appreciate the opportunity to address the regional meeting of the World Health Organization, European region. The burden of neurological disorders is high and is increasing globally and regionally. Palliative care is a fundamental component of comprehensive health care, offering relief and support to individuals facing serious, life-threatening illnesses, including neurological conditions. Together with neurologists, palliative care and primary care specialists play a vital role in addressing the symptoms of individuals living with severe and progressive neurological conditions and providing emotional and psychological support, ensuring a holistic approach to patient care. The WHO European Framework for Action on the Health and Care Workforce is a significant initiative aimed at ensuring that healthcare systems have skilled and motivated workforce to deliver quality care. We highlight the need of the integration of specialized training in palliative care, including communication skills, symptoms management, and advanced care planning, into the education and continuing professional development of healthcare workers. We encourage member states to promote and support the strengthening of the interdisciplinary and multi-professional approach to ensure that individuals living with acute and progressive neurological conditions receive comprehensive care that addresses both their neurological needs and their palliative care requirements. Thank you for your attention.
Thank you very much. The Secretariat also received written statements from International Association for Hospice and Palliative Care, Public Services International, and let me remind you to consult the written statements on the website of the Regional Committee. So now I would like to give the floor to Dr. Natasha Zapardi-Muscat and Dr. Aslavsky to provide any responses. Please, you have the floor, Dr. Muscat.
Thank you very much, President. I would like to thank all of you. We have just heard 29 of which were two group statements, really overwhelming support for the framework and for the resolution, and for this we are humbled and grateful, but more importantly also rich in content, and we will be following up with you all bilaterally to get further information about what you are doing in countries, because this will be very helpful for us to build a repository that then can be made available for everyone. Just a couple of highlights. I have noted climate change and the effect on health workers and their mental health, the importance many of you mentioned of zero tolerance to any kind of harassment and violence, women leadership and the gender pay gap, and then of course the dose of realism when we look at the numbers, when we look at the demography, and because of this, the need to really transform the way in which we organize and deliver care, and this will be one of the key elements that we will consider and take forward also at our Tallinn Health Systems meeting on the 12th and 13th December. Of course, I have noted also that many of you are talking about territorial imbalances. We heard about small countries, about island areas, migration being experienced, and the need to ensure that we have a robust system of data and indicators that give us real-time the information we need. And again, this is something that we have put on our agenda for Tallinn. The importance also of working with NSAs, with civil society, with people, I have also noted. So thank you very much for all the encouragement and support that we feel as a Secretariat. Thank you to Romania for having worked so closely with us over the past year. And the work really starts now. Thank you very much.
Thank you very much, Dr. Natasha. And now allow me to invite our Regional Director, Dr. Hans Kluge, for his remarks. Please, Dr. Hans.
I would like to sincerely thank
all the member states for a very strong support, which was so obvious, and your commitment to the resolution on health and care workforce. With the adoption of a resolution, we collectively will make the highest level of political commitment to advance the actions of the framework, but I also heard and agreed we have to do the same with the other sectors, because a lot depends also on the other sectors, not at least the educational sector and finance. Health and care workers are the beating heart of our health systems, like I was telling in my address the first day. And without them, our health systems will fail, which was made very explicit during the COVID-19 pandemic. I would like to thank you, Natasha, you, Thomas, and the whole team. Actually, Dr. Tamas Zapata is the regional advisor both for health workforce and health service delivery. So we are walking the talk in Euro because, as several of you mentioned, the problem is so big that we need to rethink the health service delivery models, which indeed will be the central theme 12 and 13 December at the high-level meeting in Tallinn, Estonia, where again I would like to invite every one of you around trust and transformation. I will reply directly to the intervention of Tajikistan in the Russian language. Уважаемый профессор Юсуф, я хотел бы поздравить министра Ямалудин Абдулу Абдулзада за его великолепное руководство по обеспечению современными, мотивированными и квалифицированными медицинскими работниками в Таджикистане, в том числе в горах. Я всегда помню, когда я был в Душанбе, ваш министр сказал мне, доктор Клуге, когда все врачи увидят, что министр учится говорить по-английски, это будет мотивировать их тоже изучать английский язык. Ваш министр очень вдохновляет. Пожалуйста, передайте мое большое уважение вашему министру, который мне как брат. Большое спасибо. To my colleagues from Israel, I would like to confirm that I'm very much looking forward to come to Tel Aviv 31st October, as requested by the country, straight after the regional committee, and to engage with the volunteers, the healthcare workers, who has my greatest respect, as well as with the family of the hostages. And I'm very humbled to have received the support of the office of the President yesterday, President of Israel, for my mission. To you, my dear friend, Dr. Dubrov, Deputy Minister of Health of Ukraine, I'm very much looking forward to my 5th mission since the war started, with my colleague and friend, Dr. Viktor Lashko, around Christmas. Deliberately, I wanted to go there that time, not only, as you know, to Kiev, but as I always do, to the front line, to encourage and pay my personal respect to all the healthcare workers. Many of them, I'm always very impressed, have not seen their families since 24 February last year. And WHO will always stand very strong, as I always say to Dr. Lashko, under my leadership, there will not be one day of fatigue towards supporting the Ministry of Health and particularly the healthcare workers. Thank you very much. Ďakujem.
Thank you very much, Dr. Kluge, for your remarks. And dear colleagues, to conclude this agenda item, we are now ready to consider the adoption of the proposed draft resolution contained in the document on the framework for action on health and care workforce in the WHO European region for 2023-2030. So I would also like to mention here that the draft resolution was co-sponsored by the number of the countries, and we would like to thank you all. And at this point, I need to ask if we are ready as a committee, if we are willing to adopt the proposed draft member state-led resolution by consensus. I see no objections. And then I think we are about to close our agenda item, right? Yeah. So I see no objection, and therefore the resolution adopted. And I thank Romania for their leadership in this important area. Thank all delegates for their working together to achieve consensus. Before moving to the next agenda item, we will now have a short break. It will start at, so we will return back to the to our work at 11:45. And thank you for your understanding, and thanks for all our support team and interpreters for being with us. Thank you.
Thank you, Chair. And if I can just remind colleagues of the informal consultation in relation to the conference papers on the ID report and the SCRC report in the Aspen Hall on the 3rd floor. We look forward to seeing colleagues there shortly on this topic. Thank you.